Flu can be a very unpleasant illness in children, as they suffer the same symptoms as adults, including fever, chills, and aching muscles. Pregnancy naturally weakens the body's immune system, and as a result, you may be less able to fight off infections, increasing the risk of becoming seriously ill as a result of flu.
Flu, now that's a good example. Great example of how community pharmacy can really help both the patients and the profession, as well as all the commercial gains that you could achieve. Well, flu allows us to do something I think we've been itching to do for years in terms of giving us the clinical aspect of our work and all that training that we've done. But I think that when patients see that we are delivering something that they perceive doctors as doing, but they can see it in their pharmacy, that's a game changer. Often people say it's very difficult to recruit patients, but I think that there's an opportunity here. You've got the over 65s with the flu contract. You've got the at-risk people, and that means those diabetic patients or those asthma patients. For community pharmacy, it's very important that you get your act together. There's so many opportunities with patients, so we could start by making sure that the staff know exactly what it is we're doing. It's also very important that you figure out how you're going to deal with the vaccinations post the jabs. For example, have you had communication with the GP, told them what you're doing? It's great to get them engaged in all of this, because often we all sometimes feel that doctors don't like it, but you'll be surprised how much they value sometimes you getting some of the patients they can't reach. We all know that there are a lot of hard to reach people. There are often people with long-term conditions that never quite make it to the GP. Well, that's our job, that's our remit, is to try and capture those patients. For us, we've already trained our pharmacists. The teams know exactly what it is that they've got to do, and then there's a whole bunch of marketing. You know, there's opportunity every time you give out a prescription to a diabetic or asthmatic, put a sticker on there to explain that there is flu. We even use Script TV, which is a multimedia format to encourage patients to understand what flu is and then ask for the flu jab. Pharmacy is so busy, sometimes we forget to market ourselves, and it's so important that we do, because without that marketing and making people aware of all the things that we provide, they will never understand that we provide more than just a supply function. I think it's important to make your GP aware of what you're doing. At the end of the day, it is part of our contract, and we need to deliver it to the best of our ability. At the same time, making sure that some of the concerns that GPs have and the practice managers have been allayed just by having that conversation. Start off with a chat about what exactly you're doing. Pharmacy needs to engage with patients, because our future isn't just going to be about delivering prescriptions. It will be about providing very important healthcare needs of our patients, to look after them not from purely the supply function, but providing clinical services that make a real difference. Pharmacy needs to deliver, because if our uptake is not good enough, I can see NHS England and many of the people in general practice saying it should not go to pharmacy in future. Community pharmacy should have been doing this a long time. The reasons are some political, but mostly because I don't think that they're aware of what we can do as pharmacists. Now, I think that with the fact that their GPs haven't quite hit all of their targets, particularly the at-risk groups and the hard-to-reach target, we have a perfect opportunity to deliver. But you do need to deliver, otherwise you know what happens, we might lose it. The 3 key steps to delivering a successful flu vaccination service is 1, plan it. Plan it with your team, plan it with your pharmacists. 2, make sure you advertise it. You are making people aware that you are providing this service. And finally, it's so important, make sure it's a quality service. Make sure patients really appreciate what it is that you have just done for them, because that's going to be the future of your pharmacy.